Assalamualaikum warahmatullahi wabarakatuh. Assalamualaikum warahmatullahi wabarakatuh. We are from group 2. We will going to present about sharp injury incident and prevention. Next. I am Najah binti Kamaluddin and I will continue with the definition of sharp injuries. Sharp injuries are the most common occupational injuries among healthcare workers. Sharps can be defined as needles, blades, and other medical instruments used for healthcare work which can cause an injury, while sharp injury means an incident which causes the medical instruments to penetrate the skin, and it may result in exposure to blood or other body fluids. Chest injury is also known as percutaneous injury. Next. The rising of sharp injury awareness began with a seminal study published in 1981. After 2 years, the first healthcare worker occupationally infected with HIV, and this incident gave a new reality of consequence to needle stick. In November 2000, the Needle Stick Safety and Prevention Act was signed into law and became effective in April 2001. And this act required hospitals to make safety engineered sharp devices available to their workers as an injury preventive strategy. Next, statistic. Based on data from International Safety Center Exposure Prevention Information Network, (AHBS), in 2020, the most frequent devices causing injury are suture, followed by disposal syringe and blood collection, being needle or tube holder. 43.7% of all sharp injuries happen in the operating room, while another 26.3% happen in the patient or exam room. Nurses and doctors are the most frequently involved in sharp injuries. That's all. I pass to the next presenter.
Okay, let's continue to the risk of the sharp injury. I'm Muhammad Nabhan, inshallah. The first one is what is the risk of sharp injuries? The main risk is the potential exposure to infection such as blood-borne viruses. The blood-borne viruses of most concern are hepatitis B, hepatitis C, and also the HIV. Okay, who is at risk of the sharp injury? The workers and others in health and the social care are at risk. This includes those who directly handle sharp, but also include workers who may inadvertently be put at risk when sharp are not stored or disposed of correctly. So I think that's all about the risk. Let's continue with the next presenter for the example.
I am Nadia Nushifa, and now we are going to talk about the examples of sharp injury. So as you can see in the slide given, sharp injury includes syringe needles, scalpels, broken glass, or even worse, the test tube that has been broken and has been contaminated with the patient blood. So when the personnel is in contact with the patient blood, it is considered as a very serious case as it can result in their health outcomes, especially if the blood is containing hepatitis virus. Next. So there are some of the management that can be done if you encounter needle stick injury. Firstly, do not panic, remain calm, and do not squeeze the wound as it can increase the risk of the blood-borne infection. Then, clean the wound by putting it under running tap water and gently wash the wound with soap. And after you have dry the wound, you are advisable to cover up the wound by using a waterproof plaster or even dressing. And then after cleaning it, immediately report the incident to the supervisor and seek urgent medical advices. Next.
Okay, my name is Sharifanda and I'm going to talk about prevention of needle stick and sharp injury. So basically the employee must have a proper training for procedures in using sharps. And with that, the employers should provide post-exposure medical evaluations for them. And third, store it right. By means of store it right is that store the needles or any sharps out of the reach of unnecessary people, such as children, typical healthcare workers, as they are quite risky. And dispose the used needles in the right bins, such as what has been shown in the slide given. And lastly, avoid using needles when there is other safe and other effective alternatives available. And next, it's about conclusion. I'll pass to the next presenter.
Okay, I am Nina Alia Niti Abdul Aziz. So in conclusion, it is important to always be cautious and aware of necessary action that need to be taken when injury happens. Since medical practitioners are more prone to sharp injury incidents, it is best that precautionary measures are well implemented to reduce the possibility of getting injured. Being injured is definitely not a choice, hence one ought to be responsible for his or her own safety, especially when handling sharps. Okay, moving on to the Islamization. Understanding the concept of Maqasid al-Shari'ah is important because accomplishing one of the objectives of Islamic rulings, which is the protection of life, can give clear reasons on why a Muslim should protect their life from anything that could bring harm to oneself. Only after attempting the best at protecting life, then one should rely on Allah, as it is mentioned in Surah Yusuf, verse 64. He said, "But Allah is the best guardian, and He is the most merciful of the merciful." Prophet Muhammad SAW also has stated in a hadith that whoever recites 3 times every morning and evening, Bismillahilladzi la yadurru ma'asmihi syai'un fil ardi wa la fis sama' wa huwa sami'ul alim, nothing will harm him. Okay, I guess that's all from our group. Thank you.